This portion of New Day Northwest is sponsored by Bellevue Plastic Surgeons.
A baby lasts a lifetime, but many women would like to get their pre-baby figure back. A mommy makeover cosmetic procedure is one way you can make dramatic changes. Dr. George Marchand from Bellevue Plastic Surgeons is here to explain. It's great to see you again. How are you?
Nice seeing you again.
So I know firsthand that things can change after a baby.
Yes, they do.
And then when you add time to that, it's just not always good. So what is the mommy makeover?
Well, mommy makeover is kind of an unfortunate term because it leaves out people who are not mommies, but you know, it's...
But you know, anybody can do this.
Exactly. So it's a combination of procedures that we do to kind of help restore the pre-pregnancy body for the ladies, which usually involves a tummy tuck, liposuction, probably the whole back, sometimes the arms, thighs, and also addressing the breast issues. Many women complain that after they breastfed, they tend to sag or lost volume, so they need a lift or an augmentation, or sometimes they need a reduction if they stay very large and just things go south.
So indeed. So this is kind of the whole thing. This is
right,
the lube and oil
makeover.
change, the whole
exactly.
thing.
It's a $50,000 tune-up. No.
Let's take a look at some of the pictures so we can see some befores and afters of this. Obviously, this is super dramatic. What did you do?
This is a 51-year-old lady who, again, you know, same story, had a child and also entering menopause. It's harder to lose from these areas, and there's no reason for her not to feel better about herself and look better in clothes and out of clothes.
And genetically, we're all predisposed to have pockets of fat in different places, correct?
Right.
So you can lose weight and be healthy, but still have
those, yeah. Men and
problems.
women are different. Men carry the fat in different areas, usually the so-called beer belly in men. In women, usually the thighs, the back bra rolls, that they don't like, and also you lose the definition of the back, the curvature of the back, definition of the buttock. You know, so it starts there and you don't know where it ends. It kind of blends into the rest of the back. So we kind of define those anatomic areas.
How did you do that? How did you hike her bottom up that way?
That's I use the Vaser technique for liposuction that also helps remove some of this harder fat in this back area, and also helps tighten the skin.
Well, that's interesting. So, okay, let's keep going. All right.
And that's what sometimes women ask, can I have the picture so I can put it on my fridge? So, not to do this again.
To make sure, yeah.
Right.
Now, so this is fat
This is the fat that's been removed, yeah, and that's the man. So there's a little bit of fluid at the bottom that a little bit blood tinged. There's minimal blood with this procedure, minimal blood loss, really. And that's some of the fluid that we put in. We use the tumescent technique. That's a solution that has lidocaine and epinephrine, so it makes it a bloodless operation, and also provides some pain control afterwards.
Now, here's something that happens for a lot of people if they've had a C-section or as they get older. You just get this area around your tummy that is no good, and you're able to actually get rid of that.
And this lady is 32 years old, and body looks older, obviously. And she came to me and says, you know, I want my butt removed from the front. So,
can't blame her.
Right. So we did again, you know, an extended tummy tuck on her and liposuction of her whole back, and a little bit on the thighs. You know, the thighs are a little bit of an issue with her because there's also some loose skin. So if you do a little bit too much, then what happens? You end up having loose skin, and that looks older than if it's a little bit chubby.
So you have to balance just a little bit. Now, with a tummy tuck, do you actually make a new belly button?
Yes, actually it's the same belly button, but it's brought through once the skin is removed. So this lady she's 54, she lost the skin from just above the belly button down to the pubic area, which also gets rejuvenated with this operation because things get tightened up. You know, with age and pregnancy, everything sags, and the pubic area sags as well. So that's brought up as well. And then we bring out the belly button through an opening in the abdominal flap. She's about 3-4 months out. That's why the incision's still red. So those kind of fade out over
After a while,
time. Might take 6 months, a year for those to fade out.
But her shape is great. She must look great in clothes. Okay,
right,
one more
yeah.
picture we want to take a quick look at.
Yes, and this is a 32-year-old lady. Again, you know, she's started out not too bad, but she did not like the looseness of the skin that's hanging over, and also the muscle laxity that she developed after pregnancy. So
Right.
we do muscle tightening to make the abdomen flat. And she also had breast augmentation at the same time, which we can show on family time here.
She looks awesome. Thank you very much. Just quickly, how much does this typically cost?
Well, it depends what needs to be done, but it can be anywhere from $12,000 to possibly $22,000.
Depending on what all you get.
Because it depends what we do, the tummy tuck, liposuction, fat grafting, sometimes to the buttocks to
Right.
balance things out, and also the breast surgery.
Yeah, okay.
And,
If you get the undercarriage coating, it's extra. No, I'm just kidding. Please visit our website after the show for more information about the Mommy Makeover and Bellevue Plastic Surgeons in general. And Dr. Marichan will be back a little bit later to join our Ask the Docs panel. Thank you for doing that. Coming up next, solving back pain with weights. You don't have to lift them either. Back after this.